During this time of uncertainty, it's wild, it's scary, it's devastating, it's heartbreaking. It's also important to take care of ourselves, right? And we've been hearing about AQI, we've been hearing about bad air quality. In fact, we have spoken to some people who have had to evacuate even without warning, only because of their proximity to the fires, and now they're experiencing bad air and they want to move to a safer place where they can breathe in better air, right? Joining us on the show are Dr. Daryl Banta from Huntington Health. Thank you so much. He is a pulmonary and critical care physician who will be talking to us about respiratory health, and also respiratory therapist Jomar is also joining us to talk to us about that. Guys, thank you so much. I know it's busy time for you. I'll start with Dr. Banta. Have you seen an uptick in patients coming in or cases because of this air quality that we're having?
Oh, yes, absolutely. The air quality has been absolutely horrendous. We're several miles away from where the actual fires started, and the smoke has just infiltrated the air. And we've seen a lot of patients with chronic lung disease, such as COPD and asthma, and all the others with chronic heart disease, such as coronary disease, that have come in and have had trouble as a result of breathing in this toxic smoke.
Right. And Jomar joining us from USC Verdugo Hills Hospital. What's it like? Was there, I mean, you just finished your shift.
Yes, I did finish my shift. Actually, it's not only from the outside; it entered inside the hospital. The hospital smells like smoke right now,
Mhm.
and it's actually affecting work. So everybody has to be wearing masks at work. And then for the first time, I've been wearing N95 just to just to reduce the inhaled smoke that I've been getting from outside. Also, my coworkers too.
Dr. Banta, can you explain the concept of AQI? I know it's air quality index, but what does that mean?
It was actually a tool created by the US Environmental Protection Agency to show how healthy or unhealthy the air is. It measures levels of ozone and particulate matter that pollute the air.
Mhm.
So a level of 0 to 50 indicates good air and it poses no risk to the population, whereas a level that's 151 to 200 is actually unhealthy. At these levels, the general public may experience health effects. Those that are in sensitive groups, they may experience even more serious health effects. At the peak of the fires and the smoke, the air quality index in Los Angeles was around 200.
Okay. Okay. So really very bad.
Unhealthy and dangerous.
Dangerous. So you mentioned that, Jomar, and Dr. Banta also mentioned earlier people with COPD, people with already lung, concerns, lung issues. But even for healthy people, you can be at risk. So what are the risks for healthy people?
Could be like your nose start getting irritated, eyes, your throat, you started having some like phlegm. All of that contributes to what's going on right now. Having like air pollution and stuff.
Right. I'm now in Washington, D.C. for an event tomorrow, but when I was in Palos Verdes, we're far away from the fires, but the air quality was also bad and I could feel my throat hurting.
Yes,
Yeah.
yes.
Dr. Banta, do you have anything to add to that? For people who are at risk, obviously people with asthma, people with existing condition, they need to be even more careful. But for people who are healthy, aside from these like irritation, can we develop more serious concerns and illnesses because of that, because of the air?
Absolutely, yes. I mean, it's common sense that if it's smoky outside or if the air quality index is unhealthy, you want to stay indoors
Mhm.
because exposure, and it can be even just a little bit of exposure of a lot of smoke or a continuous amount of exposure of unhealthy air that can cause the blurry vision, the watery eyes, the headaches, the sore throat, the watery nose, the cough, the shortness of breath, you want to be vigilant and be aware that these symptoms may have arisen as a result of small exposure. And if it does, you may need to seek medical attention.
Right. I'm shaking my head because actually before I came to Washington, D.C., I volunteered at my children's health room. And that day I noticed a lot of people coming in, kids coming in saying that they're nauseated or they feel like throwing up or they're getting dizzy. So that could be a part of it as well. And I know that it affects pets too. We're advised not to keep our pets indoors, not to walk them as much, or right when the air quality is bad. Yeah.
Yes, absolutely. It can affect
Sure.
small children. They have smaller developing lungs, and so you have to be careful with their exposure. Similarly, small animals, they can be affected by the smoke exposure as well.
Right. And Jomar, you mentioned earlier wearing N95 masks, such as the mask, like the mask we wore during COVID, during pandemic. What other things can we do to protect ourselves?
I was thinking about the air purifier. If you have them at home, utilize them. Also, be aware of your surroundings. Be when you're at home, make sure the windows are closed.
If you do have access to an air conditioner and you're indoors, that can help clean the air. The one issue is you don't want to have the intake from the outside bringing in the toxic air inside. So you want to close that valve and just make sure that it's recirculating good air indoors.
Right.
You also want to change that filter in your air if you have central air regularly, and make sure that your Jomar mentioned to close your doors, close your windows if it's smoky outside.
Right. Okay. Well, I salute you guys. I know you guys are also there trying to help keep our community, our Kababayans and everyone else safe, right? And so thank you, and thank you for your hard work, and keep safe out there.
I did want to mention one thing. My heart goes out to all those affected by these unprecedented wildfires that are affecting Los Angeles. It's truly saddening and very devastating. But I've witnessed a lot of courage and selflessness, particularly in the Filipino community. Lots of nurses and physicians are Filipino, and I've just seen such devastation among them. Some of my colleagues have lost their homes, and yet they're still going into work, and they're still being courageous and selfless and giving to one another. I've seen these coworkers and other Filipinos that have donated their time. They've been helping one another. They're going to local community centers to help with the evacuations. They're giving money, and they're giving clothes, and they're feeding those in need. It's just truly amazing. I'm super proud to be Filipino right now.
Thank you so much for saying that. I've been talking about that too. It's like out of these ashes, literally and figuratively, come beauty, right? Because we see the people coming together. And it is nice that you made mention of, especially of Filipinos. We did talk to a Filipino-American singer who lost his childhood home to the Eaton fire. And yet he joined us during the interview from the Pasadena Civic Center because he was volunteering there to help others. And so it's just amazing and truly heartwarming. Thank you for that last note, and very inspiring. So we'll end on that. And once again, thank you, and mabuhay kayo.
Thank you very much.